No, I think it's all good. It's just too hot. And then photoelectric, what are you gonna do? Yeah.
I will call this regular meeting of the Nevada City Council to order on Monday, October 26, 2020 at 6 o'clock p.m. Can we get a roll call, please? Here. Here.
Two.
Here.
Here.
First item is approval of the agenda.
Which approved. Second.
Dane and Jason, any discussion? Seeing none, council please vote. That is approved. Takes us into the public hearing on the floodplain ordinance amendment. Karen, did you receive any comments? Is there anyone here to speak in the public hearing? And then we'll close the public hearing for ordinance number 1015, 2020, 2021, the ordinance adopting FEMA floodplain management.
Approved.
Barb and move discussion. Seeing none, council please vote. That is approved. Which takes us into the consent agenda, which is any item being removed for separate consideration.
Move to approval.
Amy and Dane, discussion. Seeing none, council please vote. Aaron, is there any way to take care of the static, Marlon, so that I can trouble hearing? A little bit better. It's still there a little bit. Yeah. And with that, we'll move into the public forum, which is time set aside for comments from the public on topics of city business other than those listed on the agenda. No action may be taken. The first item in that this evening is Story County Emergency Management Director Keith Morgan is here with us this evening, and we had some discussion at the last meeting about COVID response, and so he's here to brief us on what the county's doing, so that way members of the public welcome might be wondering what the response is. It's a lot bigger than what happens here in this building, and by our organization, we rely heavily on the county, and having been on the Emergency Management Commission now for a few years, I can definitely say that we have one of the best emergency managers that there is in the state, and she does a fantastic job with this office. So just listen a little bit on what the county's been doing. From the very beginning, we worked very closely with them on things like childcare and shortages and whatnot. So with that, welcome, Keith. Fine.
Yeah, that's
Goes in. You're good. Okay. Thank you very much. Yes, I am Keith Morgan. I'm your Story County Emergency Management Coordinator. I've been in the job for about 9.5 to 10 years. And I'm here to give you a bit of an overview from emergency management's perspective on what we're doing, what we've done from the beginning, and the direction we're going forward. When it comes to some of the more tactical issues that public health is doing, I'll have to defer to them for those specifics. But to start off, our role as emergency management is interjurisdictional and interdisciplinary. We coordinate our preparations, our response, and recovery from disasters and emergencies. Typically, our interactions are focused on what you guys said, in the community that's been affected by some sort of a disaster. But as everybody knows, COVID-19 is not a typical disaster that we've been facing. Emergency management's involvement in COVID-19 response began by offering planning assistance to Story County Public Health, who is acting as the incident commander for the authority having jurisdiction. And that's one of the really unique aspects to this is, unlike, again, in the city where it tends to be a fire chief or law enforcement, this one, the incident commander, is public health, who's working for the Board of Health. The planning was conducted at 2 levels. The first thing we started off looking at is kind of internally to the medical system. What do we have to do to be prepared for the pandemic? And this was in March as it started coming towards us. First thing we started to do is to look at roles and responsibilities. What should public health be doing? What authorities does the Board of Health have? What lies within the jurisdictions that are out there? The next thing we did is we started evaluating our medical supplies needed, not only for the medical response, but for our critical infrastructure. The term that you now have become very, very familiar with, PPE. And it went beyond that, PPE, sanitation supplies, so that we could clean up some of the facilities. The next thing we started looking at was the testing and also the contact tracing, that is an important part because you want to find these individuals that are potentially positive and get them into isolation as quickly as possible so we can reduce the spread of the disease. And finally, we started looking at the optimization of the medical system. Should we start to see a spike, how are we going to utilize that? And that was done in conjunction with some IDPH, Iowa Department of Public Health, and the establishment of regional medical coordination centers, so that if we should start to reach saturation here in Story County, would we be able to move some of our patients out to, for instance, Polk County, or maybe even over to Boone County or over to Marshall County. Parallel with that, we started to recognize that this was going to have a much broader impact than just within the medical community. Some of the different agencies we started to look at is the county, the cities, our schools, Iowa State University, and some of our volunteer organizations that help us out. So one of the first things we looked at is childcare, because we quickly identified that with the shutdowns and everything, that we might have issues with getting our critical infrastructure workers, fire, law enforcement, fuel, wastewater management folks. If they didn't have people, or if they didn't have childcare, they may not be they may be unavailable to help us with those critical infrastructure. So we looked at that. We began by looking at different ways, capitalizing on some of those students that were now no longer going to classes, and we collected data on those that might be willing to provide childcare for critical infrastructure. And we also inventoried the cities and our critical infrastructure agencies to see what their needs were going to be. Another big item was sustainment of the nutritional programs, both because students were not going to be in school where they typically got their nutrition, and also we anticipated that our food pantries would also have a greater draw on them. And we had a great partnership with Barilla that offered us up excess pasta that Iowa State also helped us gather up and distribute and take on out to our pantries to make sure that they stayed stocked as we were going. And as we always talk about, during the response, you immediately start looking for recovery. And we started looking at all these programs that were bringing in grant funds and making sure we got information out to the Chamber of Commerce, to the businesses, to make sure that they knew what was available to us. We tried to communicate with the cities to let them know what different programs were out there as we were doing that. All of these actions pretty much came at once, and this was the first time that we actually activated our Emergency Operations Center. We had people working on all of these different sections in our what we call EOC, so that we could talk amongst us very quickly and take an issue and spread it out over those that were in there. The situation was very fluid, and our office started to facilitate a Thursday night jurisdictional conference call so that all of the mayors and the various supervisors and some of our key players, Chamber of Commerce was on them, Public Health was on them, and any other players as we needed. Another key player that was on these phone calls is Iowa State University, being almost our second largest community within the county. We, in emergency management, tried to collate information from many different sources, gather it up, send it out in our SITREPs out to the communities and others that were involved so that we could synopsize what's going on and give you all the awareness that was necessary. And then when we went into the meeting, we had the different agencies provide us any inputs. And one of the key things that happened during those meetings was a collaboration amongst all the jurisdictions. What are you doing about the parks? Are you allowing your parks to be open? If we are. Maybe we should come up with a consistent messaging, which is one of the best things that happen every Thursday night at 7 o'clock. So that helped us give a consistent response across all of the county, which I think was probably one of the best things that we were able to do. As we're aware, in my mind, COVID-19 has reached somewhat of a level of stability. But make no mistake about it, the underlying principles first rolled out in our response to COVID-19 are still valid. First off, we have to try and protect those that are most at risk when it comes to being exposed to COVID-19. And the second thing that we've got to constantly be keeping on our radar is to reduce the stress on our medical system. And we're in close conversations with the medical system to see what's happening. I have access to reports every day as to how many are in the hospitals from each of the different counties, what is their load level in the hospitals, and what's happening in our long-term care facilities. So we're constantly looking at that, trying to make sure that we're balanced and be prepared. The ongoing response has truly been a collaborative partnership across all of these folks that I've been talking about. And looking forward, emergency management is working with public health to implement the impending vaccination program. One of the things that we've done for that is we secured some grant money, and we have worked with the contractor to come in and help public health improve our what we call a PODS program, points of distribution, vaccination points. So we just had a kickoff meeting on Friday, and we've been discussing with everybody. And this vaccination program is an ever-moving target. The information coming out from the CDC changes, if not weekly, almost daily as to how they're going to implement it. So it's a lot of work on public health's part, and we're there to support them when it comes to it. Part of the way that we will support them is resource management. As I've said, I'm not in charge of this, and I can never foresee me being in charge. Your incident commanders, the incident commander for public health is in charge. My job is to help facilitate some of the planning and also much of the resource management. If the state gets resources, they usually funnel down through us, and we give them out to the people, and needs are funneled up to us, up to the state, to try and get them fulfilled. Another area that we're working with is our Test Iowa clinic that we have here, where people can go get tested for free.
We're going from the warm summer days to the winter, and right now we're trying to find a location that can support drive-through that will still be heated enough for them to do that testing in a car, because it's safest in the car, because it can cause people to sneeze, and you want to keep all of that potential infection inside of the car where those people have been. So that's one of the other things that we're working on. If any of you have got any ideas on facilities, we'd love to hear from you on that. We're also using grant money to secure a contractor to help us with the medical surge plan. We hope we never get to that, but we do want to enhance our plan to be nimble and agile, able to respond quickly, and utilize the resources that we have. And both of these planning efforts have been somewhat spurred by COVID-19, but they're not just focused on COVID-19. We will come away with better plans by going through this process. And that kind of leads to my last point, is that we want to gather information from everybody on what's gone well and what needs to be improved. So we will be conducting an after-action review of actions that have been taken, and again, how we could do them better. So with that, I open it up to any questions that anybody might have.
Council? I think that was informative. Okay. From council perspective, would you like to see the weekly documents that we send out, or is that too much of a news for you, or just want periodic updates?
Yeah, I don't know if this is the weekly, but periodic updates are nice. I agree. I think more information to get things from. I'd be up for that.
And we have shifted our sit reps to now we're doing them in conjunction with our meetings, so it'll be twice a month.
Thank you. We appreciate you coming tonight.
Meetings surrounding them.
I don't think so. I don't think it's some questions that we can solve that you're working on, so I think that's helpful.
Thank you. Thank you for your time.
Thanks, Keith.
If you want us to take turns turning mics off and on to see if we can figure out which one's causing that.
Things and nothing seems to change it.
About that.
Turn mine off.
Yeah, I turned mine off too. So one of ours is lit.
None of yours is lit?
No, one of ours. I turned mine off.
Okay, mine's back on. I'll just turn it back on, see if it's Brian's fault. Connection, I don't know. So try to tighten yours in, maybe that's part of it.
Muted Brian.
Okay. Yeah, make sure your connection's tight. So with that, is anyone else here to speak in the public forum? It was that easy, but it
Turned him off.
It's okay. Close the
public forum, move into old business. We have ordinance number 1014, 2020, 2021, designated an area of Nevada, revitalization area, third and final reading.
Second.
Jason Luke. Discussion? None, council, please vote. Passes, takes us to item B, resolution number 35, 2020-2021, a resolution approving development agreement with On Track Construction LLC authorizing annual corporation tax increment payments, pledging certain tax increment revenues to payment of the agreement. And Jason, discussion? Okay, council, please vote. That is approved. Takes takes us to resolution number 36, 2020-2021, a resolution approving development agreement with Mid-States Material Handling and Fabrication, authorizing annual appropriation tax and credit payments, and pledging certain tax and credit revenues to the payment of the agreement. I'd like to ask to table this. We did get a response back from Mid-States, but we'll send it back to Dorsey and Whitney so we can change some things. Minor changes, nothing big, just some of the dates for the schedule. So he's good. So resolution number 37, 2020-2021, resolution approving development agreement with South Run LLC, authorizing annual appropriation tax and payment, certain tax increment revenues to the payment of the agreement.
Second.
Dane, Sandy, discussion. Seeing none, council, please vote. Passes. Takes us to E, resolution 2020-2021, resolution approving the final plat for West F Avenue Industrial Park subdivision. Discussion. Seeing none, council, please vote. I just need the old one back. Okay. So I think we're ready to vote. Okay. Okay, try to vote again. Okay, press your button. That passes. Takes us to item F, which is discussion appropriate follow-up on 30-day review of previous resolution number 47C, revised 2020-2021, resolution taking appropriate emergency measures during the COVID-19 pandemic. So with that, we had invited Les White from Story County Public Health to be here, but she has to, there's a Story County Board of Health meeting tonight, so she didn't know for sure if she was going to be able to. So if I do see her log in, then we'll let her give an update similar to what we heard earlier from emergency management. But the documents in front of you were compiled with her assistance in review. So pursuant to the discussion at the last meeting, out, the motion was if we hit an 8% county 14-day positivity rate, it would trigger a review. So we fleshed out what that could look like and wanted to get more feedback from council on the plan. One thing to keep in mind that this will be a living document as we continue to have access to more information and more data. So in particular, there were a couple data points that we previously weren't able to access that now we're able such as the Nevada-specific rates that are up there. So I'll kind of start at the top to walk through some of the potential numbers. We talked last time about the 14-day countywide positivity rate. There's also included here what the school is using and where they came up with those benchmarks. So public health measures an absence rate of 10%, and then the Department of Education a 15% for severe outbreak authorizing full online learning. So that's where the school gets 10 and 15% from. We were able to obtain the zip code specific data from Story County Public Health. You can pull that for us on a daily basis if we ask for that. So that is available to us. They don't publish it for all communities, is my understanding, because you have to have a certain population base before you can publish that number. To be identifiable. So Nevada is large enough that we're able to publish that without it being identifiable to anybody. Test Iowa publishes testing site rates. which Les said would be more reflective of community spread, because then it shows you what ISU is doing with their number and what Test Iowa sees with community population. So Iowa State does publish their campus numbers as well, and then the state publishes their RMCC Region 1 hospital data, and that is beds available or ventilators available in the region. So those are the data points that are available to us. Walking through with Les, the recommendations in 5U would be that 14-day 8% trigger would trigger a couple things. With the benchmarks, we would pull other benchmarks. I highlighted the 50201. Last time we had discussion about school, so I put that in here. And also, Les brought up the Test Iowa being a good number, but there's some questioning about whether or not the Ames testing site will close or not. So because of that, the 50201, thinking that might be more appropriate. I think with the school, I think it's something. All of this is good to be cognizant of because I think it plays into the decision making. But at the same time, the school, you might see things sooner. So it might be a leading indicator. So it's something that would be important to watch. So isn't a good judge for the entire community. So the recommendation from Les was to rely on the local zip code data for primary decision making while keeping in mind what's going on in the county and what's going on in the school. She recommends consistency in metrics in the community so it's easier for the public to understand. So that's why her recommendation was to use the benchmarks of 10 and 15%. She said that the 8% is very conservative, so we might want to be consistent with the school and use 10%. So that's why I included that in there. On the potential actions, one thing that was really clear, and I think that was helpful to go over this with her, is that there are resources for combing through the data. None of us are epidemiologists. None of us have a degree in public health. And that's something that is helpful to have that in our back pocket because she explained she can help us look at the data and determine the extent of community spread because she said we've had several times in our community that our numbers have spiked, but it was because it was a contained outbreak within a certain organization or a certain business or certain facilities, things like that. So she would be able to help us determine if that's what's driving it or not. And then as far as the countywide number, like we saw when students came back to campus, she's expecting that to spike in January. She's going to do a little bit more research to see if she can comb through what happened before to see how much it impacted 50201. And I think that's something that if we see that the countywide numbers significantly impacted our local number, I think that changes potentially what's in front of you. But we just don't have that data right now. So her recommendation was to use the 50201 as the primary decision maker. But again, she's going to try to pull through. But she wasn't able to pull those specific dates right now. It gives quarterly, monthly, or weekly increments. And so that's what made it difficult. So she's going to see if she can get that. If not, she said what she could do is track the countywide, like if that spikes again, and track our daily to see what happens should that happen again. So basically the first bullet point is, we would work with Story County Public Health to determine what the appropriate response is and use the expertise. Some of the actions, the first set would be more automatic. So when we hit that countywide number, we communicate and reinforce safety messaging to the community through multiple channels, which we haven't really stopped doing, but we can certainly up our frequency of messaging significantly. The metrics would be compiled and published for public awareness, and that's something that we could do whenever. We can do that now. We can do that if we're above 8%. I mean, that's something that I think is open for feedback and could go higher if there's more of a severe outbreak. So, because that's one problem is, since nobody else is publishing the Nevada-specific number, that would be on us to publish that. So it's just probably, Karen, whoever is responsible for pulling it when we feel like that staff time is useful to pull it and publish it. The reminders of guidelines to be communicated to any group utilizing city facilities and reinforcing that would be recommended as a automatic action. And then following all IDPH and Story County Public Health recommendations and communicating relevant information to the public. And again, like was mentioned by Keith, CDC and those other public health entities continue to change recommendations. And that's something I've learned in managing the response to COVID of my company is people ask me hypotheticals all the time and have from day one. What happens if my kid soccer teammate have this and that? And because the recommendations change, our response has been we will follow current CDC guidance because it changes and we don't want to get boxed in with old guidance and have them think, oh, it happened now, this is how I'm going to act, and now that guidance is old. So I think that's one thing to keep in mind with this. We don't want to box ourselves in because it could change tomorrow for all that matters. So that's why, we reference the guidance and the recommendations without spelling it out. And then Les also pointed out, which is also an important piece, the governor's statewide proclamations is still governing group gatherings and restrictions across the state. And then our proclamation enforces hers. So the state recommendation is still in effect. So when we're looking at some of the other potential options, it would be the stricter of the governor's proclamation or what we want to do on a local level. So some of the things we could do, after talking, so we would talk with Les, she would work through this and see, are these appropriate. So be reducing capacity for public facilities by 50% for moderate outbreak or closing for severe outbreak. There's information there about from the state fire marshal about COVID-19 occupant capacity of facilities, if you want to review that link. Reinforcing recommendations about face coverings and social distancing, resuming cautions about group gathering sizes, similar to what we did early on. We can't enforce that, we can just put out recommendations. And then potentially tying Park and Rec programming actions to school population data metrics. So if they're seeing high rates of COVID in the schools and high rates of absenteeism in the school, then maybe we want to pause youth programming for a while. So that's kind of the summary here. Hopefully everybody followed me through this, but that's kind of where we landed on this. But really, I think we had some good conversations with Les and Public Health. Jordan can add on anything that I may have missed, but it was helpful to learn what they have available more at our disposal, because early on, like you heard from Keith, they're kind of the conduit of information. So we've received a lot from Public Health without interfacing a lot directly. So she said we were the first community to kind of go through this with her. That I can let Jordan fill in, or you guys can ask questions you may have.
Yeah, I mean, you basically said it, but it was great talking with Les and having her inform us over everything that's going on and updating it all, and very, it's great that she's able to get those statistics to us on a daily basis if we really ask for them on a regular basis. But
so the spreadsheet in front of you, those are things that I pulled last week and we're working on and pulled again with today's numbers. So you can see what those are. Again, we might want to drop off the last two columns with the statewide RMCC numbers. That's really what the state's using to drive a lot of their response. So if they do a lockdown in our region, like you saw earlier, that's what they're using, but I don't know how actionable that is to us. I know, like Keith mentioned, they do have access to more local hospital data, but that's not something that is a public metric. So it makes it more difficult for us to use the specifications and it's not publicly available. I think but then, that's one of the pieces of information that comes into play if we were to talk with Les, because she'll know what's happening at Mary Greeley and Story County Hospital specifically and help guide what she's recommending to us. So that, we don't really necessarily need action, I think, and we trusting that the resolution, or what we have on file for the resolution provides the authority to respond. You guys set the 8% benchmark for last meeting. So unless you want to change, so you can change the resolution there. We can get some input here and see if there's things you as a group have consensus that we should change in this.
I've been pretty vocal that I'd like to have a plan that people can see and understand and give everybody in town an opportunity to plan for. So I think something similar to a rubric like what the school has, I don't really want us to use that one, but it is a good way to move forward. And Brett and I have talked a lot today, and I don't know that we completely agree on what we should be using for that plan completely, but some type of forward plan is needed, in my opinion. I think everybody got the study that I tried to get out to everybody that shows how many people in Nevada work in Ames on a given day. And thank you, Mayor, for sending that out to everybody. I appreciate that. If there's any questions on that, I am not a labor shed study expert, but I did read that one a lot. But it did show that over 1,000 people in Nevada, which is an area that encompasses our zip code, not our city limits, work in Ames every day, which is about a quarter of our working population in town, slightly below a quarter of our working population in town. So I feel that we are heavily connected to Ames in that respect. That's just the people that go to work. That's not the people who go to shop or out to eat or for any other reason to drive through there. So when we look at zip code specific, while it's interesting and certainly useful, I think it's too granular. It's too focused. I think we need to look a little wider. I would prefer county numbers myself. Story County is large, but it's still a small blip on the map compared to state, country, world. So I still lean towards the county positivity rate as a metric. It's not perfect, but it is clear. I think it's relatively understood by most people who are following this. It's easy to find, both for us to publish on our website and easy for people to look up on their own for transparency purposes. That's kind of where I'm at for that. What number we use to go to a moderate or severe level for discussion, I guess, but.
My feelings will be hurt. My goal coming into this is to come up with something that we could all walk out of here supporting, even if it's not what we each may have written.
And I'm thinking now, starting with the county. I thought that was our starting place. Like what we're looking at to kick instead of the gear here is the county positivity rate. So I'm thinking we're leading with that. And I totally get the labor shed. You know, it is very revealing, and it's why people live here. A lot of people live here because of it's the proximity to where they work. So I understand that. It's another good tool. I think it should be included in the list here of another slice and dice that we can look at.
Sandy's point, our consultation with the Story County Public Health about taking action starts with the county.
I think these are adequate numbers to go by and probably adequate reactions or actions to take. once we do hit some of these benchmarks.
I agree. I think there's a lot of pieces of information to look at. I think you've done a good job incorporating all those and working with public health on it too. I think that's they're an extremely important ally, and I like that that we've talked through this with them. Did you say we're the first town? Is that what you said, that in the county that's actually done something like this?
Reached out to us, and yeah.
Wow.
That's probably something we need to tell our own people. That, you know, to Luke's point of what are we doing and how are we communicating, we're doing a lot of right things, so we just need to tell our people that. I think that consultation was great. I like the emergency management piece tonight. It was great.
I was hoping you'd hear the public health side of that tonight too, but we'll put the invite out for next time so that you hear as well, because I think it's helpful to go through all that. I mean, Keith said things tonight that, I mean, COVID in my mind has taken so long to probably jettison some of the early information from my brain at that point. Rick probably did too, because he spent a lot of time going through it.
I think too, knowing that this is a living document, like you said, we can make adjustments as it goes if new information arises. So,
Like we talked about last time, I mean, we could see like after Thanksgiving, and there might not be a council meeting right away, but I mean, that resolution, that's why we passed that at the beginning. It allows us to react quickly if we see things in certain direction. And then also leaving some flexibility, because, you know, if we go with, 8% for one area or 10%, I mean, if it goes to 8.01, we don't necessarily right away have to kick out Grandma's 100th birthday party at Gates Hall or something. We have some ability to look at what the trends are doing and what the appropriate response may be.
That would go over well. I think, Tim, correct me if I'm wrong, I think we already have most of the public facilities at 50% capacity, correct?
Yeah, we're, trying to spread people out, reduce things going down, so.
Yeah.
They've done a really nice job, some of the setups I've seen. At Gates, 4 chairs per table, and each table more than 6 feet apart, so the groups are staying separate. And I think those are important to continue to reinforce. I know Sandy talked about the 8% driving, countywide, just driving a lot of these actions. Is that where you're coming from, Luke?
I'd like to see we have kind of two different health entities with two somewhat different opinions. One more conservative than the other. In my line of work, we defer to the safest course of action, which is usually the most conservative course of action. If we're looking at a thunderstorm, or if we're going to land on a slick runway or something like that, if somebody doesn't feel comfortable or wants to do something different, we take the safest course of action. So I would lean towards the more conservative metrics of Dr. Passion, but that's my point of view. To start as we would use that number to start with. To if we exceeded that, go to I believe you had listed as a moderate outbreak, and then have another number above that that goes to severe, where then we're closing things down. That's my line of thinking anyway.
Really, like Aaron pointed out, we're basically operating as if we already are triggered moderate anyway, so I don't know necessarily if that.
So we should open everything up to 100% then.
What's that?
I said we should open everything up to 100% because we're under
I
8%.
wasn't opening up that can of worms.
I'm just saying, I mean, it does.
And some of that might be in the governor's proclamation, so we'd have to review what the state says.
We're under 8%, so.
Not arguing, Jason.
I'm
I'm not arguing.
not trying to make an argument, we're setting numbers, but we're already being more careful than we need to be, so.
Well, I think that's good. Because if nothing happens and nothing
Because
spikes,
we want to go around that thunderstorm right now.
what's that?
We're already going around the thunderstorm.
Good. That's good. The other pilot in the room understands what I'm saying. That's good.
The 50% is not part of the proclamation anymore, but you do have to say 6 feet apart. So that was the kind of the easy way for us to figure that out, is to limit it to 50% capacity.
That limits the capacity when you have to sort of,
Basically, whether we set it at 8% or 10% probably doesn't really change the outcome.
I agree, because I think if it gets bad, it's gonna get really bad. What? That's me. I mean, 8%, 10%, 6%. What's a 0.5% one way or the other, 3/4, really? Start doing the math and the numbers. What really is 0.5%? Nothing. I think we need to worry about a big jump. I think we have that covered. So 8% might be the mark, but what does really the 7% do, or 10%? It's gonna have to get, I mean, for us to really panic, it's gonna have to really get going, which it could happen after the last couple of days they've been talking about on the news, but I don't see where changing a percent's gonna make much difference. I mean, we're assuming you two are gonna do the right thing quickly, as long as Rick is. I mean, if it goes to 15%, Rick's gonna lock the front door. The PD, I know he is, you know, and so are you guys. And then that's where we have to make a decision if we're shutting everything back down again. So I don't know that, I think we're splitting hairs here, you know, on a percentage here, percentage there. I think it's, unless some staff can tell me different, I think it's been working pretty good right now, even opening City Hall back up. If we had a problem, you know. It was interesting though, Luke, that was cool about that labor thing. I didn't know that. That's good to know. But I still think the school's a big driving thing.
I think
I know some guys, sorry.
No, good.
You know, you're talking about labor, you know, there's some companies in Ames that you sniffle and you're out. So it might be safer going to work than it is going to the grocery store, you know, some of those places. So I don't know. We don't know what everyone else is doing. We just have to do what we think is going to keep us safe. And I think we're doing a pretty good job of that right now.
Do you think it's important, Brian, to have something defined, some line, whatever that number is,
Don't we have that already, 8%?
That's when, I mean, the motion last time was to start talking about it after 8%. That's not the official wording, I don't think, but.
In our resolution to give you guys control, don't we have a number in there?
Well, the one that gives us control is no number. So, I mean, that was more leaving up our judgment. The Sandy's motion last time was to open City Hall, but trigger a review of our policies at 8%.
And that's
where the 8% came from.
Yeah, but then we
I thought we had it too.
we approved that though, right? So
And that's kind of where that's.
So we are at 8%, pretty much. That's what I thought. I say that's why I think 8%. I mean, that would be what that is, right? 8%, we need to really look at it again.
Yeah, so, I mean, I guess what Luke's getting at is to go to recommended benchmark, whether you want to change greater than 8 to be moderate outbreak. It's more what we define it as.
Oh, but we have to define the percentage.
So it's basically, if we want to change this definition, because our actions, we're already acting as if we triggered that. So it's not going to change our action. Currently. Whether you want to change that definition.
8% is based on the Story County though.
Well, 8%, basically, that came from Dr. Passion
Right.
saying, and that's what I think what's hard is, he was right. He said there's nothing good to use. There's no good recommendation. He likes 8%.
Right.
So he is one medical provider likes 8%. That's what makes it hard, because we have that opinion, then we have another medical public health opinion.
And our 10% is zip code based.
So basically, we have two public health professionals in different positions that have thrown out a different number because there really isn't one that's out there. So Les says she likes the 10% because that's what's already established in our community by the school, and that's what we were using for that decision.
That
She feels
10% is,
far. She feels it's a good number, and it's also consistent with the key.
that 10% is the absentee rate, though. 15% is the positivity rate.
10% is the moderate, isn't it?
6 to 14. is
6 to
moderate.
14, yeah.
And the 10% is the absentee rate, like Luke said. So that we're talking about learning online learning and stuff, that's not really applicable to what we're talking about here. We're talking about shutting down facilities and.
I like the fact that we're able to use our zip code numbers and the Story County numbers and coordinates with one another. So if Story County is at 26%, I don't know if we can find those old numbers.
Well, Story County is at 26%, we're above 15.
Where were we at when they were at 26%
Yeah,
back
that's what we
in,
need to find out.
you know, is there a big difference? Were we at 10% at that point? Were we at 8% at that
And I
point?
think that's what's hard is, because the student population itself can be insulated. Yes, there's crossing between faculty and students, but it's a lot of online teaching.
Yeah.
So there's more diminished crossover from students to the larger campus population than there normally would be, which then means there's less between that and the Ames community. So yes, between the data and Ames, there's significant crossover, but how much an outbreak potentially could be contained among the student population because so much is done online right now.
And
So-
Jason, the one metric we do have is that absentee rate and all the quarantines the school did or has been doing, and that all spiked late August, early September, which coincided pretty much with Iowa State. Now, percentage-wise, I don't know where that lines up, but the spike we saw was at the same time as the spike they saw.
Right, we had a few cases of actual cases, but the quarantine, because of the contact tracing, was the big part.
Right, yeah. But the spike
As
of
far as
both
the amount
happened.
of cases, it wasn't a lot.
Right.
So
I guess
that's why I like to keep that balance, you know, let the county trigger it, and then as we look at our numbers here in town, we can adjust as we go.
So I guess my question is, would the rest of the council be okay with changing the moderate outbreak to greater than 8%, knowing it really doesn't change anything we're currently doing? Or do you want to leave it as recommended at 10?
I like the 10%. That's
I'd like to
my-
see it at 8%.
Splitting hairs. Really?
We kind of are, but I want everybody to walk away with this.
I would want 8 too.
I'd like it at 8%. I'd like to see the severe outbreak lower too. Around 10, 12% as well.
Luke and Sandy say 8 for moderate. What's everybody else say?
Like 10.
I like 10.
Great, 10?
Come on, 8 to 10.
I don't care unless you need a tiebreaker. I really don't. Whatever the other 5 decide. Gotta be 3 and 2. There's no tiebreaker. Come on.
Why don't you just go with 9
I'm
and then
Switzerland.
split the difference?
9.5.
I like Jordan's idea, 9.
Go 9 to 14, moderate outbreak, and then 15 above severe outbreak.
Perfect.
I can do with the 9, but the 15 I think is pretty high. I'd rather see that lower.
What's lower to you, 14?
Maybe more 12.
14, 12?
Are we basing that number on anything?
I can't say that I am, other than 15 is too high according to Dr. Passion. I spoke to him a while back. By the time it gets to 15%, already here. If the idea is trying to prevent it, if the idea is trying to help the most at risk, we should start earlier. And we're talking about just closing down City Hall and parks and stuff like that. We're not closing down businesses or anything like that.
I think we have to weigh that concern also with, you know, the importance of people's plans. You know, if you're planning a big family event at a facility, that is a big deal. A lot of planning goes into that, and that could very negatively impact some people. So I think that's worth considering too. I mean, I want to walk that balance between keeping people safe, but also not, you know, turning someone's life upside down.
I agree. That's the whole reason I think having a plan that people can see and that's why we're here.
I'd do the 9 to 14 and 15 plus, but to me, I don't think we need to go any lower than 15 for severe.
And when we look at the school numbers, students are more likely, or kids are more likely to be asymptomatic. They're less likely to be affected by the symptoms as much. So when we see absentee rates or we start going by schools numbers, it's going to be lower than what the
We're not
community
going by
numbers are
school
going to be.
numbers though.
What's that?
So we're not going by school numbers, we're going by testing.
I know.
numbers.
I'm trying to answer a question you asked like 10 minutes ago.
Oh,
Totally forgot.
Sorry.
I don't even know what my question was.
Okay, never mind then. Pretend I.
Anybody, I don't remember. What was the positivity rate in the state when she shut the bars down?
Well, she did those specific counties.
Yeah, there's specific
Whereas in
counties.
Story County was like 20-something
Yeah,
percent.
at one point, we were 26% in Story
Yeah, that's what
County.
I'm saying, and,
That's what I want to know, what we were here in Nevada though.
right. That's what I'm saying, I mean,
She's gonna try to see if she can get that information.
Which is why this is a living document, because if we get more information like that, obviously we can make, you know, changes.
I mean, if we were at 20%, then yeah, you know, needed to do what we did, or didn't do. Probably should have done something.
is that something, information we can have that they know, is it even out there? What Nevada was?
Yeah, that's what she wasn't able to identify tonight, but she was gonna try to do some research for us.
Then we're splitting hairs. Pick a number, because it's just a trigger. I mean, it's not like a definite what we're doing.
Yeah,
We also have to keep in mind that we have
Yeah, we're
Story
shutting
County
things
and
down
the
with
state
15%.
that also.
Yeah.
in action.
He wants to shut it down at 12%. Where I stand.
What are you saying over there?
Oh, no,
Now we
he's
just sidebar.
sort of.
Sidebar through your plexiglass boxes.
Yeah.
Yeah.
And you're in your penalty box over there.
So I got my microphone shut
So
off.
I feel comfortable, I'll say it once more, I feel comfortable with the 9 to 14 for the moderate. And then anything over 15 is what I would consider severe.
I agree with Jason.
That's where I'm at. Where are you at, Brian?
That's where I'm at too.
That's where Brian's at.
It's a moving target, so we can
Yeah.
always change it.
Yeah.
I'm kind of lost in the shuffle now, because I thought we already had 8, so I'm like, whatever.
Well, that's for our city numbers,
It's county.
The 8% would be county, and that triggers the, all right, let's make sure it's not in our area, and we're watching our numbers regardless. But
Everything I've been talking about has been based off the county positivity rate,
Me
just to be
too.
clear. Is that what you're
not
talking about?
me, no, mine's for city positivity rate. So that's what it says here. 50201, 14-day positivity rate, greater than 9 to 14% is what I said. What I would consider moderate.
So 9 to 14% in 50201 is a moderate outbreak, and 15 plus in 50201 is a severe outbreak, is what you're saying.
Right.
My concerns with using the zip code data is it's not available to the public to look at without
Well, we can,
us publishing it on our website.
But Brett, you said we can't make it
Actually, it
public.
is available online. There's 2 different sites that you can find all of this information on. They're both pretty accurate, so I can send those 2 links out to you guys after this if you'd like.
Did that just happen?
No, they've been up for a little bit. I don't know how long,
I've been
but
told that was super secret information for,
some of the information that has been provided to you guys in the past was information that wasn't known to the public. But there are websites that show a lot of these same figures. Doesn't show the absent rate, doesn't show the RMCC beds available or the ventilators available, but it does show the positivity rate, the 14. These are more specific for our actual community, whereas the ones that you can find would be more of the county and the state level. So those county figures that you are wanting, they're on those websites.
I think Luke was looking for the 50201. So on your sheet, the 14 days, so coronavirus.iowa.org is where I think has the best information. So they have the 14-day Story County rate, and they also have the RMCC rate. The school website, they do a great job updating once a week their 2 school numbers. And then Les can provide columns 2, 3, and 4 to us, but that we can publish. We asked her permission if those are able to be published. She said yes.
They update those every day, don't they?
But they don't put it on the internet. We have to ask, and then we can put it on the internet.
That's what I'm
So-
saying. We could put them on, we could post them.
I think if we get to that 9 to 14%, that's something we should be posting daily at that point. If the county is up, super high, then we should probably be posting both county. Here's what the county is, and here's what the data is. But as long as we're under those,
Everything on your spreadsheet.
maybe
is
once a
publicly- Public data, so.
simplicity's sake, I think it's easier to use one number, but,
and I would choose 50201.
and my problem with 50201 numbers is it's too localized. If you're planning for a hurricane, you need to start doing it before your feet start getting wet, if that makes sense. I've shown the data that how closely tied we are to Ames, and everybody in town goes to Ames almost every day. Go to the restaurants, we go to the Target, that's where all the ISU students are working.
Not everybody goes to Ames every day.
I understand that, but 1,000 people a day go there for work 5 days a week.
That's
And that's just the people who have to work. And that's data as of this year. I think we are tied to Ames whether we like it or not. So to look at such a small number, small area of our zip code, I think we're behind the curve if we use that.
We're not only using that number though. We're using both. We are using the county at that 8%. We'll
And I think that's when it gets complicated trying to explain it to the general public, to look up 2 separate numbers and explain all that. I think it's easier when we're trying to publish this for clarity and transparency that we use one number.
I would be more than happy to explain it. Over and
It's
over
hard
and
because we're
over.
looking for a simple answer to a very complex situation.
Right.
And I think our number and the county numbers lately
Been
are
fairly
similar. They
close,
probably
right?
will be in the same ballpark. If for some reason we did see county number jump to 26, our 3-day rate probably, I would imagine, be jumping, even if 14-day hasn't moved quite as much yet. But that's, again, where the previous resolution provides authority to respond.
Right.
So I think we're all, basically what I'm saying is I think we're all pretty close with what would actually happen.
Yeah. What numbers and where are we getting them from?
You need a motion or something like that, Brett?
I'll defer to Aaron's guidance on if we need a motion or if we don't, or.
I think right now, we just need to give direction, but I think you've got to have a majority of your council obviously giving the same direction. So, because I don't think we're looking to actually change the resolution today, which is what would require a motion. So I think you guys just need to get on the same page of what are you comfortable with? I guess as I'm listening to the conversation, one of the questions I have is when we're throwing out these different numbers, what exactly is happening? What's the response going to be? Because there's kind of one response here, and what's going to happen if it becomes a severe outbreak? What's the response then? Or is it just you guys are going to revisit again the policy to see if you need more stringent measures in place? So I think we can throw out the numbers, but looking at this and listening to you guys, I'm not sure what happens at those different thresholds.
Well, it says here that if we had a severe outbreak, we would close facilities.
And I think the most important part is the top bullet point. At an 8% countywide number, we start consulting with the Story County Public Health and taking their recommended actions.
Yep.
I think to me, that's the most important piece of all of this, because we're going to do what Story County Public Health is recommending that we do once we hit that 8%. So regardless of what numbers we as a group are picking, that's going to drive the response anyway.
Well, you mentioned context mattering too, as far as if it's a contained outbreak versus community spread. So that,
I mean, because we could call up, we could see 50201 being at 12%. We could call up and she could say, hey, 90% of these cases are all in this one employer. They've all been sent home to quarantine. I don't think you're going to see a spike across the community, because they've seen that happen multiple times already.
they've got their finger on the pulse on that kind of a thing, so they can kind of help put it in context
So
for
that's
us.
where, I think the point about being transparent and people understanding is important, but at the same time, you don't want to use a sledgehammer if the situation requires a staff level. And that's where public health will guidance and expertise help.
So that's pretty simple. 8%, we tell everyone 8% we're gonna follow what Story County Health wants to do. 15%, we're gonna shut down city facilities. I mean, that's basically what it says.
Public health could tell us before the 15% is going
Right. That's a pretty good explanation to the public too. At 8% or higher, we're gonna follow what Story County Public Health is recommending. Because if they know it's one frat house in Ames is smoked the whole house and it runs the thing up and they can, shut down, like you said, they might say, nope, it's contained. They might say, you better start shutting stuff down at 11%. I don't know how much easier it gets than explaining that to the public. That keeps it pretty simple. That 8% was the county number, right? Yep. So then we're using county numbers the whole time.
But if we also have a big outbreak here in town and not the county,
which also is one possibility.
right,
They can start here.
they have that ready to go too. By
That's
having
why
both
it's
sets of
important.
numbers are important.
Both numbers.
Right. Right.
So, thinking ahead of, you're making an infographic for social media. I think Brian hit it on the head at 8%. We consult with Story County Public Health and take their recommended actions. Stay with 15%, would be at 15%. We, on our own, would do.
That 8% could be be triggered countywide or citywide. 8%, 8%. If Nevada hits 8% before the county does, then we still need to talk to Story County Public Health.
Why don't we say that we're going to take the provisions of the moderate outbreak at 8%, unless Story County says that we don't have to, so that people know this is what we're going to do at this number that they can monitor. And we know that at 8%, X is going to happen unless a provision comes out from Story County that says, this is isolated to a frat, or this is only in, a retirement community in Slater or something like that. It's not a Nevada issue, and then we can remove it. Because if we say stuff's going to happen at 8% after we talk to some other people, that doesn't give a whole lot of planning and preparation opportunity.
I guess I don't get the plan. What kind of planning opportunity does somebody need to have?
For shutting down facilities.
Anything to me. I mean, I'm just saying me. I know everyone's different than me, but really, what kind of planning do you need to know when they say it's 8%? I mean, I'm a little confused on the whole. I get, I'm listening, I pay attention, but I don't get the whole, what are we planning? Keep our kids at home? If that's the trigger, keep them at home. Everyone's gonna decide what they want to do. I don't want 8%, I don't want to go to the store, I don't want to go to Ames, I'm not going to work, whatever.
No, we don't have the power to tell people to do that or not. We're kind of talking about facilities, 50% capacity or closing the doors. That's mainly, and going out and asking people to wear masks and take
Well, because the next
precautions.
8%, I don't want Tim to call everybody and cancel everything for that weekend, and then the next day, Story County says, well, it ain't your guys' problem. Well, we just got the cart way ahead of the horse. I think we need to refer to the more of the professionals. I think if we're making a decision beforehand, I think it's too, this whole disease is a revolving door. It's really what it is. It's all, it's a revolving mask one day. It's not the next day. Trump says he's cured in, 2 days. Then he's not. And someone's a hack and someone isn't. I mean, that's why I hate just to put I think 15 is a pretty good number to start to shut things down, but 8% is more of a trigger, I think, to, hey, where do we need to be? What do we need to do? I don't know.
Well, I think
My tire pressure's down to 20 pounds, I'm gonna buy a new tire when you just need to put air in it. That's kind of how I look at it.
Well, the idea is prevention, I think. If we close it down and find out we didn't have to, at least we were doing preventing stuff, where if we get to the number and then we're like, okay, we're going to call and see what happens, and it comes out, oh, we should shut things down. Well, then there was time where we could have been preventing potential spread, and we didn't. And that's the whole goal, I think.
Well, I think that's why having the 8% being in everyone's definition a conservative number. So that's still early in an outbreak. And it gives time to be thoughtful and measured, and I think the public would appreciate that than just knee-jerk.
Well, it's not knee-jerk if we're planning right now and have something ahead of time.
Well, but if all of a sudden you started closing things down, and like Brian said, you find out that it was an isolated outbreak and you didn't need to, I think it's better to be prudent when you have the number set at a conservative level.
But even that, I think, it's not going to jump to 20 tomorrow when it's at, 6 or something today. It'll be 6 today and then 8 tomorrow and then 10. It'll be a slope. People will see potentially something coming.
It could also jump in one day and then drop again. You could have.
It could, and then we open it back up.
Yeah.
And that's fine.
Well, it's not, because how 3 weeks to give us a decision. They're gonna do it in a day or two.
Oh, yeah.
They're gonna know.
She responds really fast.
That's what I mean, they know day to day what's going on. If there's a big outbreak, they're gonna know if it's a certain place, it's Brett Barker's house, it's, the donut shop. I don't know.
And they'll know more than any of us in this room. So I like giving them a lot of credit here, and yeah.
Well, the mayor mentioned that putting together an infographic would be really helpful, and I think that would get to Luke's point about something we can put, and to Aaron's point, like what happens, and you have a lot of the things, the actions right here that are gonna happen, that we can have it available, make it really a simplistic way to tell the public we have some plans there. You know, what they, you know, not specific on each one because of all the facts that we've all brought up, but there's some steps, and make it, you know, simplistic and visible, and
That's pretty much exactly what I'd like to see. I just don't know that that we should have the vagueness of it's going to get to this number and then we're going to consult and then we might act.
And I think that matters. I mean, if we're going to cancel things, if we're going to kick people out of facilities for things that they've been planning for weeks, months, whatever, we should have a really good reason to do it. And if we overreact and kick them out and flip someone's life upside down because of something they've been working on for a long time, you know, there's a balance to it. I don't like this, well, we get 20% and we're kicking everyone out. That just doesn't, I mean, when an outbreak in one single facility or one single employer who is quarantined could dramatically impact that, so.
Or we could wait and then that ends up making it exponentially worse by having a large event that we don't cancel. I see your point. I understand what you're saying, and I know where you're at on that.
We're talking about, for events, already at 50% capacity with social distancing and masks.
And if social distancing and masks work, and I know I've gotten on this soapbox before, but if social distancing and masks work, then this shouldn't be an issue, as long as it's being enforced or being adhered to.
I mean, really, we're already taking mitigations for any groups, and so it's whether we think it's worth a few hours of Story County Public Health or not. I mean, personally, that's one thing that's hard for me. I look around and Brian does great grain bins. Jason knows how to do logistics and transportation. We have pharmacy tech, pharmacist, economic developer, airline pilot, prevention specialist. We all have our expertise, and I feel blessed that my background makes me more qualified than most mayors in the state right now on this issue, but I still don't have a degree in public health.
Do we know when the numbers come out that we would be basing it on, like 10 a.m.? Is that what we're talking, like the 10 a.m. numbers or something like that? If we did that but then had maybe a 2 or 3 hour lag where that's the window where if it's above a certain number, then we have till noon to come out and say to the public it's above this rate. So then we have to, maybe I don't know if I'm saying this clearly, but there's a window.
That Story County number, that changes throughout the day. I mean, constantly. It's constantly.
Well, I'm wondering if there's a window where we can consult before there's the ambiguity of it's above that number. Are we going to do anything or not? If we say we're going to take the 10 a.m.
literally go over 8% and then go right back down below within the same day.
But if we say we're going to take the 10 a.m. number, but then we're not going to actually say what the 10 a.m. number is till noon. And in that window, if it's above, that's when we consult whoever we're going to consult.
Right.
So the decision comes out at noon every day. Is that possible? Is that viable, Jordan?
On some of the figures, I think it would be, but other figures, they don't really have them updated until the next day. So today's figures won't be available until tomorrow after 2, 3, 4 p.m., depending on when they update it. So on some of the stats, yeah, we could definitely get something regular, but not all of them.
And ultimately, I think, and that's why the main numbers we're seeing are 14-day rates. This thing moves in weeks, not in hours. So that's also important.
So one of the sites that I'll be sending you guys is, it goes over, like it'll show the date that's the last person that passed away from COVID. It'll show how many people were tested yesterday, how many people were positive that were tested yesterday, that percentage of that. So, I mean, you'll get a lot of these statistics that you're wondering, and they are updated on a daily basis, which is great that they do that. But those are the numbers that we really need to focus on moving forward, like the ones that Les has been giving us, or Keith gives us, or something like that, along those lines. I mean,
I'm just trying to find a way to work through the whole looking for advice before we act. If it gets to 8.1, for example, so if we had somebody, you probably takes the 10 a.m. number of whatever metric we pick and looks at it, and if it's above that number, then you consult with whoever you're going to consult, and then at noon it comes out, and so people know at noon we'll publish the number, and people will know what's going to happen.
I will definitely look at the figures every day, and I can reach out to Les or Keith on a more regular basis than what I have been. We spoke to Les probably 3 times in the last 3 days, but that wasn't that way before. So we can continue to have these conversations with her on a more regular basis. That way we can have more accurate, updated data, so we can make those decisions if we need to, if we get to those percentages. Does that work?
I don't know if I'm saying what I want to say clearly, but I'm just trying to bridge the gap between acting when it hits above 8% and making an action, and versus 8%, we go and talk to people for a while. I'm trying to find a way where we can do both.
I guess my question is, what's 2 hours that situation do?
A day.
I mean, because ideally, you know, when we wrote this, it was pulling it for, like Brian said, a day. Because the numbers are, I mean, they're changing every minute. But I think ultimately that's what's hard is, you know, we're getting in the weeds and we have to think about what Aaron hit on. What is this actually going to do? The difference between noon and 5 p.m., what does that do?
And we're also only talking about our facilities. Really, how bad could it get? Because City Hall's open for 2 more days after it goes for 8%. Unless you're going to shut down the businesses and shut down the school. I get that 1,000 people go to Ames and work every day. But do all 1,000 come through City Hall in one day? No. Or the library, or the city garage. Or even if we have a big thing at Gates Hall. I mean, okay, worst case scenario, and I'm with Luke on this one. Let's say there's 100 people at Gates Hall. And then there's an infection going around in there. So however many get it, hopefully nobody gets it. But that's also, on the weekend. So if it goes to 8% on Monday, it might, so we shut them down, and then it comes the weekend, and now it's down to 4%. That's what I'm saying is, we can do all we want and say we're going to shut down City Hall, but City Hall's as good as any place with the glass. Really all we're talking about and shutting down city stuff is we shut Tim down at Gates Hall because there's an event, or at the pavilion. That's really all we're talking about.
Which is kind of ironic, because at Gates, a lot of times your big crowds are going to be people coming from out of town anyway.
Right. In their family and whatever. But it's, unless we can do any number we want, shut down City Hall all we want, but unless you're going to keep 100 people from going into Fairway or any other place in town, we're just really pulling a straw out of the pile, so I don't know that having this plan to shutting it down, I mean, I can jump on board with Luke shutting down, but the number would have to go up. I don't think 8% is severe enough if we're just going to automatically slam the door on everything. I mean, I think having a plan, hours is ridiculous. When it's a daily thing. We're just even the city of Nevada. I know everyone counts. I don't want to get sick. I don't want anyone in this room getting sick. Absolutely, I don't want even people I don't like getting sick. I mean, it's just nobody. But it's a small deal unless we shut the town down. Just shutting City Hall, like when, I don't even know, Karen, how many people come through here a day? 10?
A lot less than it used to be.
Yeah, and Rick, how many criminals you got come through the front door every day?
All kinds.
Yeah, they volunteer to turn, yeah. But I'm saying realistically, you get half a dozen people in a day?
It goes in waves, but like Karen said, our numbers are way down, and most people that come in, call and make an appointment for whatever reason. We don't get a lot of people coming to make an appointment.
So we should be responsible, absolutely. Luke, I don't want you to think I don't think we should be responsible, but I think we don't need to be ridiculous about being responsible either. I mean, if we have a plan, 8% is a good number. We prefer if we shut them down Monday afternoon, Tuesday afternoon instead of Monday afternoon. Really, I mean, what kind of exposure are you looking at? Not even a dozen people, other than if there's a big event. That's a weekend thing, and that'd absolutely be something that we'd have to look at. And Tim knows that better than anyone, what's going on, and that'd have to be a weekly thing, so. That's kind of where I'm at on it. I don't think we should just sit and do nothing, but I think the numbers we're talking about are fair numbers. I say we just take a consensus and move along. We could talk about this all night long.
So I guess what I'm kind of digesting, and know Aaron and George are making notes too. So it sounds like there's some support to make the moderate outbreak be based on 8%.
That's what everyone kind of liked, that number 8 and 15. I don't know if anybody likes it or not, but.
I don't like it, but I'll go along with it.
Right. I don't know. Yeah.
And that's ultimately what I'm hoping.
Well, that's reasonable. I think we need to get the health department involved at 8%. If you want to automatically shut down at 15%, I don't think that's
And
unreasonable.
this spreadsheet, we can pull and post weekly now, or, I mean, if you think that's valuable for us to put that out there, these numbers.
I would like to see it, no matter what we do. It'd be nice to see them weekly, bi-weekly.
Do you want like Marlis to put this out too, or?
I mean, why not? The more information out there, the better. It's not like it's a secret. Like Luke said, it'd be nice if you could get some of the stuff that we can't find. So if that means Story County, we can post it on Monday after the weekend or Wednesday by the time we get it, or once a week, or it'd be nice if we get it, and then it'd be nice if it was out where everybody else could grab it too. Then we can look at COVID.
Update this weekly snapshot. And I mean, it's like the school's numbers they post on Friday. So I mean, it's just based on when we pull it. So we can, if we pull ours on a Monday, you're using the school Friday number, but it's just a snapshot on time. So we can update that weekly, we publish it. Make the change for 8% as a moderate outbreak. There's still some contention about what severe means, but again, Story County Public Health would guide the number no matter what number you pick, they're guiding our response anyway.
Are we talking about county or zip code numbers?
I honestly think the 8% number, if either one hits it, we need to have the county look at it. I mean, if we hit 8%, we know absolutely we need to do it because that means it's up in Nevada. If the county hits 8%, then like you made a good point that, we have a lot of costs. So I don't think we pick one or the other. I think either one of them gets 8%.
Whichever is higher.
Do the same with,
Right.
Yeah, okay.
do the same with severe.
I think that's pretty fair because.
We'd be consulting with Story County Public Health.
Right.
If they said it's contained to Ames, you have some time.
Because we don't want to go this county and Nevada gets over 15%. We say, oh, the county isn't doing nothing yet. So, I think either one of them triggers it, and that's where we go. I think we keep track of both of them.
Nodding. So is everybody okay if we use whichever hits it first? hopefully meeting.
By the way,
As long as we're consulting with
I know.
Story County, as
Story County, yeah, because they're gonna,
long as we continue at that
We
15%.
do that as long as we're using Story County Public Health to guide action.
So if we go over 15, but they say it's isolated, we aren't necessarily blanket shutting things down, then yes, I'm fine with that.
That would be my understanding. If the local one did, we probably would.
maybe, yeah. That's where that resolution would be.
But, I mean, we've got some big employers too that could isolate that incident.
Yeah, but says we got isolated, we sent everyone home then, but that's.
I wasn't gonna use any names.
I will, because they're the biggest employer in town, you know, so. No, it could be, it could be.
Maybe we should be more
Still about
careful
what
with
they do.
infection control, but there are a lot of people there.
So,
So we're at a point, everybody is okay. Yes.
Roll the clock, Mayor.
Okay. And mostly thumbs up.
You're getting a shrug from me.
I'll consider that thumbs up.
A thumbs up, I'll give you a shrug.
Like I said, my goal was, even if it wasn't everybody's favorite thing in the world, we came to something that we could all walk away from here.
I think my biggest, and this might be getting into the weeds a little bit, but like, Tim, how many weddings do you have there this winter in Gates?
Oh, not very many.
Okay. That makes me feel a little bit, I guess, and I'm kind of coming at this from another perspective, you know, having had my wedding a few years ago and obviously being around a lot of couples getting married. If we decide on a Friday, oh crap, we're at 15% and shut things down and they're getting married on Saturday, I don't think that's reasonable.
it is what it is. I mean, I'm not comfortable with 20% and saying, okay, come on in. I mean, things happen in life and that sucks, but.
But Gatherings isn't going to have to answer to that.
What's that?
Gatherings isn't going to have to answer to that. Community building isn't going to have to answer to that. We're the only ones doing it.
I think that's probably got to be a message that is delivered, that the council's now given this consensus and just, we'll be watching numbers. If we get to that 8%, you're going to be notifying them that we're.
I would make that clear to them as far in advance as possible that they're kind of taking a risk if they're booking at Gates Hall. 'Cause I mean, you're talking about thousands of dollars you're dumping into vendors that may or may not be funding you for it.
They're going to take a risk wherever they go.
And that's going to bankrupt a person, potentially. That's a big deal.
Like Sandy said, if you're having a big wedding event right now, you're taking a risk as it is to be booking that, knowing what's going on.
Oh, for sure. Something from the state could come down just as easily as something from the city, but I think just to protect us.
Oh, it makes, yeah.
Yeah, I just want to make sure it's communicated that they know that the council has taken this action and. Okay,
No, but
okay.
our contract has something in there about events unavoidable or whatever.
You know, we just tried to work with everybody that's had an event. Fearful that there's going to be an issue with COVID and want to refund.
Okay.
You know, it's just the right thing.
Okay.
We'll communicate with, you know, people going forward. I don't agree. Not having funding what we have coming up. There's any big events.
Yeah. And it's a slow season for them anyway, but.
We'll take a look and do.
I think that's something that's communicated, potentially 50%. Then you might be close. On that, we don't have any further action, so we move on to G, which is a free support of $7,500 for community vision 2050 planning, which you heard from Main Street and ABC at the last meeting about what that is for.
Do a motion on that? I'll move to approve.
I'll second.
Brian, Dane,
I'll be a brief line in the ointment again. I think we should be covering the whole cost of this to avoid potential conflict for people throwing money into the pot for this project and then maybe having some projects approved in the project, and that could be construed as greasing the wheels, so to speak. Not that I'm accusing anything like that of John or the NEDC, but I think it's for our protection.
How so is it greasing the wheel, as you say?
Well, you know, they paid for half of this project, and then the NEDC comes forward and says, we'd like to do X program and have it in this capstone plan, and it ends up getting in and something else didn't. I'm not saying it's the reason it happened, but it could be construed that way by somebody outside.
A strategic plan isn't something that is everything that you put in there has to happen. I mean, things can change, problems arise, there's money issues, things like that. So what I was sharing with you over our email in regards to this is a community-wide strategic plan. It does not just benefit the city and the employees. It benefits everybody that lives in our community, everyone that commutes to our community, everybody that comes to our city for weddings, things like that. It benefits everybody. So when NEDC is putting forth some of that money, well, they're in the same boat, in the same spot that Nevada is in, the city of Nevada, because they want the same things we do. We want community development. We want that growth. We want things to move along and progress. So to me, I do not think this is greasing the wheel at all. I believe that over half of the actual cost, because the cost is actually a little over $11,750 is definitely reasonable on the city side of paying for things. And like I also mentioned in the email, we really need to be focusing on the amount of money that we have and the amount of money that we're spending, because we have things in the pipeline, going down the pipeline. So we need to be conservative about our money and not spend it on random stuff all the time, because it does add up. These $1,000, these $5,000 things, they add up very quick. And there's going to be a time where we don't have that extra excess money like we do currently. So we need to be very conscious about us spending money.
Kind of where that came from is, in the 2020 plan, there were more than a dozen entities involved in creating that, and there will be again with this one. But for logistics, we talked about how difficult it would be to go ask each entity to split 10 or 12 ways, and also knowing that some of those entities are very cash poor was also a difficult ask to act. So really it came down to, you have the two entities that have the most available funds to just quickly split it in half and make it easier. It's not going to, no matter who funds what, it's not changing the process. The process would be driven by UNI program. They're coming in and facilitating it, so it's not going to change the process regardless of where the dollars are coming from.
And we have ultimate say over anything that we do with money going forward anyway. So if NEDC, and if there's conflict at any point, we still have the ultimate say. Yeah.
Discussion on that. None, council, please vote. And that passes. Takes us to new business. Finally, new business A, resolution number 41, 2021, resolution adopting the procurement policy.
Move to approve.
Second.
Brian, discussion. None, council, please vote. Passes. Item D, resolution 42, 2020, 2021, resolution adopting the segregation of duties policy.
Move to approve. Second.
Barb, Sandy? Seeing no discussion. Please vote. Triggering professional services agreement for innovative wastewater treatment facility improvements phase 1 construction phase services not to exceed $199,000.
Move to approve.
Discussion on that. Council, please vote. Resolution number 43, 2021, resolution setting the date for public hearing on proposal to enter into a sewer revenue loan and disbursement agreement to borrow money thereunder in a principal amount not to exceed 1.5 million.
Move to approve.
Second.
Any discussion? Seeing none, council please vote. That passed. Takes us to E, resolution number 44, 2020, 2021. Resolution setting the date for public hearing on proposal to enter into a sewer revenue loan and disbursement agreement to borrow money thereunder in a principal amount not to exceed 3.4 million.
Move to approve.
Second.
Any discussion? Council please vote. Passes against the text. He's been waiting for all day. Third purchase of plow truck for street department.
Still awake.
Approve.
Second.
And discussion. Vote.
Guess we can't approve it.
Technical difficulties, you don't get a truck.
Put it on your garage.
This is the 11th Street truck, isn't it? Yeah.
No, I don't live on 11th Street, so that's good.
You have the bus on it.
No, I don't care about that. Buses will run through the snow. We'll be
Does
fine.
that corner down 15th Street?
It was a new addition.
Yeah.
Your mom or so.
Vote again. Is your buttons going?
No.
No.
Yes.
Did she just say vote again?
Let's take a roll call. Sampson,
Aye.
Nielsen,
Aye.
Spence,
Aye.
Eric,
Aye.
Hanson,
Aye.
Aye.
Passes. Takes us to G, resolution number 45, 2020, 2021. Resolution approving a memorandum of understanding between City of Adaitta, Iowa and public and professional maintenance employees, local 2003, IUPAT, July 1st, 2018 to June 30th, 2021, and authorizing and directing signing of the MOU to move on.
I'll move to approve.
Second.
Our discussion. Okay, seeing none, I'll go to the passed. Takes us to H, resolution number 46, 2020, 2021, a resolution adopting the COVID-19 policy.
Move to approve.
On this one, I would maybe recommend to add a whereas line in there that would give Jordan the authority to change the policy as needed in accordance with the CDC or Iowa Department of Public Health. Because this is one there's going to be changes. We've already seen it since the first drafts. So I think that it's not coming back to you guys all the time.
So
Can I amend my motion as Aaron just stated?
Thanks, Luke.
We'll second that.
So the city administrator's authority to change pursuant to public health guidelines or something?
Correct.
So
Yep.
That's exactly what I just said.
Yeah, what Luke said.
Okay.
That Aaron said.
Okay, so everybody clear? Then. Please vote.
I'm hanging out there.
Accidentally hit the wrong button at first.
That passes, takes us to report. We'll start with city administrator.
Almost.
Other than my report that you received last week, I have nothing unless you have any questions.
I'm sure you already heard most of what I've been mentioning on our other items presented to the commission. Still about Highway 30 and interchange project there, potentially. Basically, the ask was to program the whole project in conjunction with the past sincerity of that program. Otherwise, continuing to work on the field house. There's Story County is doing a housing study, so I participated in that to provide them with a perspective on our current housing situation. Luke and I participated in the YSS Circle of Champions, which I think was pretty informative, talking about some of the issues on the eastern side of the county there. So some of you may hear more about that later. Potentially we'll be doing a community coffee around some of those more mental health, substance abuse aspects of the pandemic and how that's affecting the community. So we're trying to pull that together for November. Since Jordan's was October, we'd like to get one in November, so Luke's kind of helping with that.
Everybody I've reached that's replied to me is willing and able. I'm just waiting for a couple of key people to reply still.
So be on the lookout for that. We would probably do it online like we did in most of the ones we've done. And Karen will talk about the auditors. I won't steal her thunder, but I do want to thank her for all the hard work. It's fantastic as usual. So, Story County Emergency Management had a meeting, quarterly meeting last week, lasted until after 10 p.m. So quite long. And then, yeah, Larry will talk. I'm sure we'll talk about the meeting of birthdays. With that, do you have any questions for me? Council reports.
I know I always talk about Runners United Nevada, but our final race of the season happened on Sunday. We also had the Donut Dash on Saturday, which was planned on 10 days' notice and had pretty good turnout considering it was 22 degrees at race time. The chili cook-off along with the 5K on Sunday went really well. The Historical Society was really happy. I've gotten a lot of Facebook messages and emails in the last 24 hours thanking our organization, which it isn't just me in the room, the mayor and Councilman Spencer on our committee and 6 others as well, but thanking us for having our in-person races. And at a time when a lot of in-person races weren't happening, we took steps to make sure that people were able to do it in a responsible way. They were really well received, and we're fortunate, I think, even to have an organization that specializes in doing events like these, because a lot of 5Ks in the area and Ames and a lot of the other towns, it's a certain group that does it for a certain purpose, and that's it. Whereas we have a group of people dedicated to doing things like that, and it goes back to that Main Street study that they had, looking for more events like that. And I think that Nevada is fortunate to have a group of people. I'm obviously the one that's in the spotlight a lot, but a group of people that are dedicated to doing this. So I think it speaks very highly for Nevada. But I just want to share that both locally and from other towns, we've had a lot of really positive feedback about the races. So.
Thank you for coming to the microphone so the public online can hear.
You bet. I just wanted to thank you all for being advocates for the community and listening to dialogue back there. It's clear that you care about the community and you're passionate about that, and that's the kind of counsel I want. So with that being said, the bad news now, Tuesday night we were responding to a fire call that was an actual fire. Our engineer took the corner a little too short and hit a police car. So it's our fault. We have about $5,000 damage to the police car. We're not sure. The engine fared much better, but there's a couple of parts that will need replaced. Both vehicles are operational, but certainly scrapes and dents are not the image we want to portray.
I don't have anything other than what was in my report. If you guys have any questions for me? Thanks.
Saw the crews out for the first snow of the year.
Yeah.
I don't really have a lot to report. We're working on completing J Avenue and getting that opened up, probably a few weeks away. Weather's really not going to hurt us on that. We thankfully stopped in time, so we'll get everything back, and then we'll start again in the spring. So I guess other than that, I don't got really anything.
So that looks like they're gonna pour the sidewalks here soon.
Yeah, they're going to pour quite a bit of sidewalk here tomorrow. They're just, it was a little chilly today. I guess it's going to be a little chilly tomorrow morning, but it's warming up after that, so we'll start.
Will they get J all the way complete or just enough to open it for the winter?
No, we'll be done. Yep.
Council, anything? Go to Tim with Parks and Rec.
I really don't have too much. We've shut everything down for the winter and kind of switching gears, getting equipment ready for snow. These guys have been hassling me back here all meeting. So on the bright side of everything, we didn't have to spray for mosquitoes this week or this summer. So life is pretty good. So with that, any questions, I'll be happy to answer them. Very good.
Public safety.
Well, I'm glad they volunteered to provide you that information on the fire truck and police car. We've been really busy the last week. I can't go into details, but we've been really busy. And guys are doing the work that we expect. Some had some pretty long hours last week, but things are going well. We had a total, we had two dates where people could come in and do the testing. And we had altogether, we had 6 people that came in and passed. And so now we're starting our backgrounds and getting all that other information. So we're sort of shooting for 1 hire before the end of the year for the academy in January, and 1 more in April. If we're fortunate enough, I hope we can get 2 people out of this 6, but we'll wait and see. So, as you guys got questions, that's all I got for you.
How many people would you normally have apply for that? Like, is 6 a good number? Or?
Well, probably 3 cycles ago, after we did the initial testing, my sergeants really cranked on my arm about doing different testing. So I figured, well, we ain't got nothing to lose. So we did it different. We're probably unique because nobody else does this. We don't take any applications, paperwork, nothing. All we want you to do is show up and take the test. You take the test, you pass the test, then you can submit all the other paperwork. Saves us a lot of grief, a lot of other issues that come up. I will say that, Ray, did you tell me this, or was it from Josh and Chris about how they like the idea that we're not taking any names. All we want people is to show up.
Yeah, our implicit bias training talking about.
Yeah. With everything that's going on with implicit bias and systemic racism, that sort of thing, the idea that the groups that are involved in this sort of thing really like the idea that all we want is people to show up and take the tests. We're not asking for any other information. So it doesn't matter if you're male, female, what color of the rainbow you are, you show up, you pass the test. And if you want to keep going on, you submit your paperwork. So that really saves us a lot. So getting back to your initial question, when we hired Matt and John and Andrew, we only had 11 people show up, but all 11 passed. We've had as many as 90 and 100 applications, but not had that many pass. So in this case, when we had all 11 pass, that was a good group. And so 6 people that passed and are moving forward, I'm a little optimistic. So it's hard to tell. We've only done it twice now. So again, it was my idea. We tried it, but I give my credit to my sergeants because that was the one that they really wanted to do. So we'll see how it goes. So anything else?
Is there a reason why we would wait till April for the second one? If we had 2 qualified people?
Well, we're down 3 people.
Right.
Okay, well, I gotta have people train people. So if I have 2 people in the academy and then they graduate, then I got 2 other people who's gotta train those 2. We've done multiple trainings before when we've had to, and I don't like doing it. It burns out my people. They get really tired of having somebody sitting next to them all the time. And the paperwork has to be very, very detail oriented. Most people that get to the training, we don't have any problems with. The ones that we're having a hard time with, you have to document everything if we're going to let them go. So that's why we do it that way.
Okay.
Anything else?
Any more talk about going for that 3rd one this year to try to get a little bit ease up on you guys a little bit?
Well, I was hoping maybe the budget committee would have discussed it, but I don't know if that was in their discussion. But if that was to open up, we probably have to do another testing, but I need to have some lead time to do that. The academy meets, the training starts in January, April, then August, and then December. That's typically the 4 classes that take place. So, and right now, I've been receiving emails from the academy. They want to make sure we're going to use that slot because there's a long list of departments that want to get people in, and there's not enough slots. So we're fortunate to be able to do that. So, all right. Anything else? But I will train all the people that the council will give me. So, all right. Thank you.
Just wanted to mention a couple items. One, we had our annual city and Burke meeting today. That has been delayed a couple times. Normally we have that in April, and that was the beginning of the pandemic, so we postponed the face-to-face meeting until August 10th when the derecho came through and kind of messed up that whole day. So anyway, we finally had it today. And well, there's nothing new. We did, we find out everything is pretty well going pretty good between Burke and the city. And we were able to get an update on what their where the current state of their expansion is, which is, I believe, this week they're bringing one of the lines on duty and long awaited. So they'll be progressing as they start producing there. We gave them an update on the current plans for the wastewater treatment facility and then a number of other things. So it was a good discussion, and we'll be back to our normal April meeting next year. So anyway, the other thing that was pleasant news that we got last week, maybe most of you know about it, but the city was awarded a $2 million sponsored projects grant last week. And so now the fun begins in trying to find projects to do. A lot of projects were identified in the application, and now we'll pare those down. But $2 million would go a long ways to doing those stormwater quality projects in the city. So with that, as Sean mentioned, we're about wrapping up the work this year in the downtown project. And as would normally happen, at the end of the project, there were problems with the foundations for 2 of the light poles. It happened to be the last 2 that were going in. On the east end of J Avenue on the north side, by the current Windstream building, we discovered there were 6 3-inch conduits running parallel with the back of the curb, 3 under 3. And in one of those cases, we'll have to do a spread footing. They're down about 3 feet, and the footings go down about 5 feet. So we devised a spread footing to carry the weight over the top of those, but it will require an extra work order. So, but we have a plan devised, and we'll get them done so the sidewalk will get completed this fall. So with that, I'd be glad to answer any questions you might have. Thank you.
Karen.
I went to IMFOA last week. It was interesting. We usually have breakout sessions, and we didn't. We all stayed in the same room, same place, and we were spread out. And But it went well, and we have Ted from the Department of Management and the DOT, the Title VI coordinators were there talking about that. I think Mayor mentioned the audit as an interview. We've had that, and so I think they're done asking for things anyway, so that's a good thing. It'll probably be a while before we get our actual report. Working on the annual financial report, hopefully that's wrapped up here in the next week or so.
Over Aaron?
Nothing for me.
Ends reports. The next item is a closed session, so we'll be switching over to that. So any of the public wishing, so we'll stop the Facebook stream. Any of the public wishing to be part of the public stream meeting when you come back from closed session and join the Zoom. The Zoom will remain open, but we'll go ahead and close the Facebook stream.
Hey, Ray, would you like to inform the council real quick about the UV lights that you ordered in? And
Sure, before we do that, yeah, it was pretty slick. Craig can talk about the UV.
Yes, so we ordered 4 UVC blue lights to sanitize different city facilities back in March. They were on back order because everybody in the country wanted them. These are the same type of lights we use in our ambulances to disinfect after every run. We got those lights 2 weeks ago, week and a half. So we started distributing throughout the city. Library has one, Park and Rec has one, City Hall's got one on that side, Police, Public Safety has one, and we're now working on a schedule to sanitize various rooms and facilities at City Hall. So before your council meeting, we sanitized the council chambers with a UV light. So
that disinfect books?
Yeah, we had to do a little research. Over the course of time, it could impact paper. So the library had to do a little research before we started doing that. So it's like a sun type thing. So exposure to UV light. So you might see signs around. It's not that anything is in danger. It's just that we don't want people walking into a UV light room. There's a potential, over long-term exposure, a retina and all that stuff.
There's basically a tanning bed in here?
What's that?
Basically a tanning bed in here?
Yeah. So those are just some of the steps that we're taking to make sure that we have clean facilities.
Okay.
Thanks, Ray.
Oh, yeah.
Need a motion?
And so with that, we have a closed session pursuant to authority found in Iowa Code 21.51C to discuss strategy of council matters. The present litigation is imminent. This disclosure would be likely to prejudice or disadvantage the position of the governmental body in that litigation.
Move to go into closed session?
Second.
Okay, Jason and Dane. So with that.
Can we take 5?
It's ready to go.
Okay, please vote.
Yeah, I gotta use the washroom.
Yeah, we can take 5 maybe.
Yep. Say, sounds good. And we are now going into closed session. The screen. Karen can stop.